Hello, everyone. Thank you for joining us this Tuesday afternoon or morning, depending on where you're calling in from. I appreciate you joining us every month. This month, we're going to go over some really hot topics, things that are going on in our news, our legislative branches. Right now, you may be aware there's a lot going on with Medicaid, Social Security, a lot of spending, what's going to happen in the rural communities, what's going to happen with Social Security disability, Social Security. These are some of the top of mind concerns for patients. And you're going to have me talk about, I'm going to talk about a lot on Medicare coming up the next couple of months leading into the new enrollment period, as well as Medicaid, because so many of our patients in all our blood cancers may have had a challenge with Medicaid, maybe on Medicaid or seeking some assistance with that. There's going to be a lot of challenges coming up. Um, Word on the hill is that in this new big beautiful bill may be on Trump's desk by the 4th, which would be by Friday. And everybody's duking it out right now as to wanting to have changes. And I will get that information to you. If you join our Financial Connect group, you will have the latest. I sift through, I do all the research and bring all that information back to you. If you join our Financial Connect group by scanning this QR code, you will have access to the latest and greatest without having to go through everything and try to decipher that yourself. Please do that. You can share concerns. I can respond to any comments you make, or you can send a question, and I will be glad to respond to you. So please sign up for our Financial Connect group. It's a great way to find out the latest things that are going on. Next slide. So these are some of the things we plan to cover today. Some of the 11 mistakes in Medicare selection that could cost you thousands and could possibly cost you your plan. Let's go back. And how to navigate devious sales practices, which are so prominent and so as hurting so many people, and then protect your insurance options. Understanding Medicaid, what is your sole or dual insurance coverage, and understanding changes to Medicaid and how these changes can impact your insurance coverage and where you access care. This is one of the big things that are on the bills right now. Next slide. So, a lot of you are aware of some of the predatory practices and you may have been a victim to predatory practices with the sale of Medicare products, especially Medicare Advantage. In fact, there's a lot going on with some of these companies or sales practices and companies and have been sued as a result of what they've done. So while most agents that sell Medicare plans are honest and they're trying to give you the best service, there are some very, very, very devious practices that have availed themselves. And you need to be aware of them and how not to be fooled or harmed because it can cost you your health care coverage. Be aware of changes in beneficiaries from traditional Medicare without your knowledge. Review your plan often. There are people who are called up and saying that I have my Medicare, I went into the doctor, and for some reason I am no longer covered under that. And they may be changing beneficiaries on that. And you are the beneficiaries of a Medicare plan. Enrolling beneficiaries in plans, these are devious practices that are unaffordable. They may say, this is the same thing that you have with your current coverage, and we're going to get you a better coverage, but less. And it turns out to be something completely different. Make sure you review and understand the total cost of your plan, including your prescription plan, because they all will affect one another, what's on your formulary and what is not. Misleading beneficiaries is what some of these agents do into believing that costs will remain the same and it and your doctors and treatment centers will accept your plan. Don't know that until you go and check yourself. If you go into a reputable place, such as CMS.org, or talk to your state health insurance providers, they will tell you places to go to get reliable information, accurate information, and where you'll understand what you need to do to make sure you get the best coverage for you. So, um, make comparisons of all your coverage, including your prescription coverage and the cost to make sure you're getting the best plan for you, and that your doctors and your treatment centers will be in network, including your pharmacies. Next slide. Some other predatory practices will include legitimate Medicare representatives will not make a home visit or solicit sales by phone. I know I've been getting a lot of calls by phone, and I'm an insurance agent, and I know that they're doing things that are not what they're supposed to be doing. So if someone says Medicare is free, guess what? They're lying. Whether you pay for it or there's a grant that's paying for it, Medicare is not free for anyone. There are premiums that must be paid for health insurance products. If an agent tells you to switch plans shortly after enrolling because they say rates are increasing, do not switch that plan. Plans can only be switched during open enrollment periods. What they're trying to do is switch you into another plan where it looks like it's good on their side, and they are making money for that. They're looking for a commission. They're not looking out for your best interest. If a person tells you that enrolling in a Medicare Advantage plan will not affect Medicare, do not believe them because it will. Don't believe an agent that tells you that the best plan for you will always be an Advantage plan. You need to determine your coverage needs and possible restrictions that Medicare Advantage plans have. Medicare Advantage plans are known to have a smaller network. If you are a person who needs a broader network, you go to doctors out of state, like specialists, or you go to doctors, numerous doctors because of their specialty. You may need to look at a different type of Medicare Advantage or a different plan altogether. If you still qualify possibly for a Medigap or consider a supplement plan, they may be best. Don't believe when an agent or someone tells you that you can switch plans anytime. This is not true. In fact, this just recently happened to my son who is disabled, and they were saying, well, we could drop your plan for you to come here and we could always pick it back up later. I knew better. I called him out on it, and I even had a Medicare, somebody who works in compliance go out and talk to them because found out they were doing that to quite a few people. So be aware of who you're talking to and what they are trying to sell you. Next slide. So agents are mandated to always use fair and honest sales practices, disclose all the information when marketing Medicare products. Beware the following sales tactics. High pressure sale tactics, not disclosing all costs, saying you've got to get this, tomorrow it's going up, next week the rates are going up. These are all lies. Door to door solicitations. No one should ever be knocking on your door. In fact, anyone who's talking to you about Medicare, they have to get your request to speak to you. Sending unsolicited emails. Never open an email from someone if you have not requested them to send information to you. While giving a sales presentation, you may find these coming up in the next few months, saying to come to here, we're doing a sales presentation. If they obtain names, addresses, and enrollment applications at a health fair or a promotional events like a seminar or workshop, that is not ethically correct. You can only give that if they're actually asking for your names and you actively give it to them. They are not to bring any enrollment applications with them. Misleading information or enticing you to plan into plans that do not meet your medical needs. They may also have hidden permissions to contact when they need to have your explicit permission from you before they contact you. Be wary of unknowingly granting permission by entering your information on pop-ups or etc. on your email. You're going to get a lot of them. If you are already enrolled in Medicare or a Medicare Advantage plan or a Medicare supplement plan, especially August, September, going into the new enrollment period, there's going to be high pressure out there for you to switch plans. Be wary of what you do. Next slide. They may induce a beneficiary, which would be you, person who's trying to get Medicare, to purchase or change their health insurance by making misrepresentations or omitting information about various Medicare products just to make a sale. They may omit telling prospective beneficiaries they do not represent all Medicare plans that are available to them. This is one of the bigger areas of omitting information. Agents will tell you we sell Medicare plans. Well, do they sell all the ones in your area that are available to you? If they do not, they're selling the ones that will make them the most money. So be wary. Just because they sound like they're good doesn't necessarily mean they are the best plan for you. You need to do comparisons with all the plans available to you in your area. Next slide. So these are tactics that Medicare agents can use or brokers can use. Agents can market Medicare products such as Medicare Advantage plans, Part C, or Medicare prescription drug plans, Part D, by doing all of the following. They can meet Medicare enrollees in their home, but only if they are invited. They can knock on your door as a cold call and talk to you. They're not allowed to do that. They can compare the benefits of more than one Medicare product. That is actually to your benefit, so you make sure you're getting the best product for you. They can distribute information and forms in a retail setting, office, or and participating at a health fair or promotional event. They cannot do applications at a promotional event. Medicare agents can give nominal value gifts to enrollees for attending a marketing presentation, such as maybe a lunch or maybe a sticker or maybe something, but they can give you a nominal gift for enrolling in their or attending their presentations. Medicare agents can call potential Medicare enrollees following state calling standards and the FTC telemarketing sales rules do not call registry. If you are in a do not call registry and you have not asked someone to give you a call, they are actually violating those rules. And there are fees and penalties associated with them doing that, especially if they do them over and over again. So be aware of what your rights are and what their rights are and what they're maybe doing incorrectly. Next slide.
Unknown caller.
Buying the same Medicare Part D as your spouse. As we all know, that very few people have spouses may have the exact same medical conditions or use the same medications as you do. So, and there are no family discounts, unlike long-term care or insurance, other insurance products. There's no family discounting for getting the same Medicare Advantage or Medicare plan. Generally, spouses take different medications, as I mentioned before. Get the plan that's best for your individual needs. Refer to the Medicare Plan Finder to estimate the out-of-pocket cost for each of you under the plans in your area. Look at all of the plans in your area. Do a good, complete, accurate, all-inclusive comparison so you make sure you get the right one for you. Review the plan's pharmacies because some plans give you better rates if you use a particular pharmacy for your prescriptions. Again, that may be different for your spouse based on what kind of prescriptions they are under. Next slide. So, the second of the 10 potential traps you can avoid is not reviewing your Medicare Part D plan yearly. Part D plans can and do change their copays, deductibles, and formularies often, and I know at least yearly. Some of them do those mid-year, and you need to be aware of what's going on now. Some of those Medicare Part D plans have changed things on formulary. Do not leave your plan on autopilot and expect it to remain the same coverage every year. This is a very big no-no. People have been caught. Last year, when Medicare Advantage started dropping some of the Medicare Part D, started dropping some of the big drugs for multiple myeloma, such as Revlimid, off of their formulary, that meant people were going to pick those things up 100% of their own at 28,000, approximately 28,000, depending on where you are per month. That is not viable. So if you've changed your medications or some of your drugs have gone generic, or some of your drugs, you may be on a new drug that has no generic, be aware of this. You have got to check your Medicare Part D plan. I would say every month or every other month, especially if you're changing drugs. Next slide. So number three, going out of network in your Medicare Advantage plan. Medicare Advantage plans, as I mentioned before, have smaller networks, which means you have to stay within that doctor or within that healthcare provider or that health provider facility. So be aware that some Medicare Advantage plans require you to stay in network, almost all, with their providers, doctors, and hospitals and pharmacies in order to get the lowest copayment. Many plans will not cover out-of-network providers at all, except in an emergency. And you have a time period, usually 48, 72 hours, where you have to report going out of network to an emergency facility in order for you not to be charged. So do a little homework and review your plan and do some comparison shopping. Then take advantage of the open enrollment periods, which are October 15th to December 7th, and make the changes if necessary. Do not forget to make sure your medications and doctors will still be covered by the new plan you are considering switching to. You can check with your doctor to verify they will accept your insurance. A lot of times they know that well ahead of that open enrollment period. So call them, say you're considering switching. Would that still be covered? And if you go to a different specialist, include them in your comparison shopping. Next slide. Four, not switching Medicare plans mid-year if needed. We kind of just went over that. You can switch Medicare Advantage plans during open enrollment each year from October 15th through December 7th. An additional Medicare Advantage open enrollment period is held every year from January 1st through March 30th. I'm sorry, I have 32. There's no 32 days in any month that I'm aware of. Thank God. We have enough days in a year. During this time, you can switch to another Advantage plan or drop your Advantage plan and return to original Medicare. You'll also be able to join a separate Medicare Part D drug plan if you return to original Medicare. There is a special enrollment period where you can switch plans outside of those open enrollment periods I just mentioned. And that is if you have certain life changes, such as a marriage, a divorce, or have a dependent child who has become disabled. I mean, there's so many different things that can happen under life change with you. Next slide. Number four, continued. If you have a five-star quality rating advantage plan, and you'll know that when you're signing up for it, or they should have told you when you get your documents in the mail, you can switch into that plan anytime during the year. That is the only time for Medicare Advantage when you had that five-star quality rating plan. Use the Medicare Plan Finder to search for five-star rated plans in your area, and you can find that on cms.gov. So, additional information that you may need in order to make the just best choice for you for your Medicare plan. If you are at least 64 years and 9 months old, you can sign up online. Now, some of these things may be changing, but as far as I know, this is where it is currently. There is a 7 month window to do so, 3 months before your birthday month, and 3 months after your birthday month. You can enroll in Social Security later. You will be billed for any premiums until Social Security clicks in, at which point the premium will be automatically withheld from your Social Security check. Next slide. Number four, continued. It is possible to delay enrollment in Medicare Part B if you or your spouse is covered through a current, and I make sure you understand this, a current employer. Most people sign up for Part A, and in most cases, it's free. Also, you may want to delay signing up if you plan to continue contributing to a health savings account. If you work for an employer with fewer than 20 employees, you must sign up for Medicare Part A and usually need to sign up for Part B. Don't assume it's going to be automatically done for you. At this point, Medicare will become your primary insurance. Ask your employer if you can delay signing up for Part B. Some employers will not allow you to do that. You will have to sign up for Part B or Part A, and then that will become your primary insurance. Next slide. So number five in potential traps you can avoid. If you buy a supplement plan, not picking the right Medigap plan. This is very important. If you buy a supplement plan or a Medigap plan within 6 months of enrolling in Medicare Part B, you have to have Medicare Part B, A and B in order to sign up for a Medigap plan. You can get any plan offered in your area, even if you have a pre-existing medical condition. Remember, within 6 months of enrolling in Medicare Part B. If you try to switch plans after that, insurers in most states can reject you or change or charge more, significantly more, because of your health. So pick wisely. So the states that will allow changes, even with pre-existing health issues, include New York, Connecticut, Massachusetts, Vermont, Washington State, and Maine. So if you live in these states, review their rules because they will vary among even those states. There are 12 states that have enacted the birthday rule, which will allow you to make changes to your Medigap plan. This is another more information that some agents will not tell you. They may say you sign up for Medigap plan, that's what you're going to have. You can't change it. And in these 12 states, you can on your birth on the birthday of your enrolling, you can switch within your Medigap plan as long as it is at least equivalent to the plan you're on. You may change from United Healthcare to Aetna, and sometimes the prices can vary among those plans. Those states that will allow you to change on your birthday rule is California, Idaho, Illinois, Kentucky, Louisiana, Maryland, Nevada, and Oregon. So review those rules. There may be some things that vary among them as well. Next slide. Find out about your state's rules again and plans available at your state's insurance department website. That's SHIP, S-H-I-P. You can also find more information about Medigap policies in your area at medicare.gov. Now, one of the big things I've heard, and I don't know how this happens, but people forget to sign up for Medicare at age 65. It could be that they're working and they're not thinking about it because they know they have their employer coverage. Or they may be on COBRA, they may be on retiree coverage, but you still have to sign up for Medicare because if you lose those open enrollment periods, you may have a lapse in your coverage, and you're gonna need to understand that COBRA, retiree insurance, these things are not considered creditable insurance. So you don't want to have that lapse and end up with additional fees, especially for Part B, that will continue for the rest of your life. So even if you are working, it's best to review your options for Medicare coverage and do some really smart comparisons when you're first eligible to sign up for Medicare. If you aren't receiving Social Security benefits, you'll need to take action to sign up for Medicare. Usually when you have Social Security, it will automatically sign you up and you'll get the card and the information, everything in the mail. If you are not, and even if you're on disability and you don't see that Part B come in, you might want to be concerned and call because you don't want time to lapse and can't go back and get that Medigap policy that you thought might be better for you. Next slide. Another potential trap is not signing up for Medicare Part B if you have retiree or COBRA coverage. I just kind of covered that. When you turn 65, Medicare is generally considered your primary insurance coverage. Over any other coverage is considered secondary unless you or your spouse is covered through a current, not a retired or other plan that has 20 or more employees. It has to be 20 or more. COBRA, retiree insurance, or severance benefits is not considered to be primary coverage after you turn 65. That is considered what is creditable is like your regular insurance or like your regular employer insurance. And COBRA, retiree or severance benefits is not considered creditable insurance. This means that if you don't enroll in Medicare, if you have COBRA, retiree insurance, or severance insurance, you may have gaps in coverage and be subject to a lifetime late enrollment penalty of 10% of the current Part B premium for every year you should have been enrolled in Part B, but were not. And if you have the income that is higher, that is even going to make that premium even more. Next slide. You may also have to wait to get coverage if you miss a window for enrolling when you turn 65 or 8 months after you leave your job. You can only sign up for Medicare January 1st through March 31st each year with coverage starting on July 1st. You can go to medicare.gov for more job-based insurance information for after you reach the age 65. Next slide. The eighth potential trap is forgetting about Medicare Part B enrollment deadline after leaving your job. If you're insured with your current employer of 20 or more employees, you don't have to sign up for Medicare at age 65. It's automatically done. You don't have to. You can choose to keep your employer's insurance instead, so you don't have to pay Part B premiums. However, there's a caveat here. If you do not sign up for Medigap when you're first eligible to sign up for Medicare, which is at age 65 or under age 65 if you are on Social Security disability and get Medicare after being on Social Security disability, then you will be automatically signed up. But if not, you need to be aware of Medigap rules and requirements and whether you're going to get pre-existing conditions waived. You will have to sign up for Medicare Part B within 8 months of leaving your employer, even if you are on COBRA, retiree, or severance insurance. If you don't, you will have to wait until the next enrollment period of January 1st to March 31st for coverage to begin. This means you may have several months in lapsed coverage, and you will also get hit with a 10% lifetime enrollment penalty. It does not go away. Next slide. Number nine, making financial moves that can increase your Medicare premiums. Most people I talk about do not think about this. They're thinking about retiring and accessing retirement benefits such as 401ks, IRAs, maybe switching from a regular 401k or IRA to a Roth IRA so they can take tax-free income later. But there's a problem. Most people aren't aware that higher incomes can end up paying a higher premium for Medicare Part B. This will be a income-related monthly adjustment amount called IRMA, IRMAA. You'll also pay a premium upcharge for Part D prescriptions. A lot of people don't think about that. For prescription Part D coverage as well. So be careful when converting IRAs to a Roth IRA or making big withdrawals from tax-deferred retirement accounts such as annuities, 401ks, pension plans. Speak to a financial advisor to determine the best withdrawal procedures to protect you from Medicare surcharges, even if you're a couple years out, which is best to maybe start changing some of this withdrawal from IRAs or Roth or determining your retirement so you can know what you're going to be paying for your Medicare Part D and for possibly Medicare Part B that is based on income ahead of time. Don't wait until it's too late to make that change. Next slide. So number 10, potential trap, not contesting the high income surcharge for the year you retire or subsequent years. So if you retire and you're 65 and you sign up for Medicare, your Part D premium or Part B premiums are high based on your income when you're working, which means you get that upcharge and your income drops because they use, for example, your 2023 income tax for your 2025 year to determine whether you're subject to the surcharge. If you don't go back and change that, say, oh, I'm no longer working, my income has dropped significantly, then you're going to continue to pay those upcharges. You can contest that and have that surcharge reduced or taken off. So if it has to be done on appeal, certain life changes, such as marriage, divorce, death of a spouse, retirement, or reduction in work hours, can change that surcharge and have it reduced or eliminated completely. At this point, you can ask Social Security to use your more recent income instead, and you will need to provide proof of that life-changing event, such as a death certificate, retirement notification, reduction in your work from your employer, divorce certificate or marriage certificate, or like I said, death certificate of the spouse. Next slide. Oh, so I guess it's 11. Signing up for Medicare Part A if you want to contribute to a health savings account. So you cannot contribute to a health savings account after you have signed up for Medicare, but that doesn't mean that you have to stop making contributions at the age of 65. If you or your spouse has health insurance through your current job, not through a a retirement plan, you can delay signing up for Part A and Part B and keep contributing to a health savings account. This is no longer an option if you already signed up for Social Security or your employer has fewer than 20 employees. It seems like those small employers are being picked on. It seems like it, right? You must also prorate your contribution to the health savings account in your retirement year based on the number of months before you were covered by Medicare. So if you have a health savings account and you can contribute as much as you can to those and you plan to retire and you plan to get on Social Security, you might want to do that now. So you can take advantage of that money coming out tax-free to take care of copays, deductibles, premiums, those sorts of things. Next slide. The benefit of the health savings account. After you turn 65, you can use the health savings account money tax-free to pay premiums for Medicare Parts B and D and Medicare Advantage plans, as well as other out-of-pocket medical expenses. However, you cannot use it to pay for Medigap plans. When seeking advice about Medicare plans, be sure you are working with reliable and ethical brokers and agents. Very, very important. Next slide. So now we're going to pivot a little bit. This is what's really, 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 really in the news right now, and I'm going to keep people updated on the Financial Connect page. So you need to understand Medicaid changes that can affect you, things that may be coming. Everyone by now has probably heard about the big, beautiful bill that is slated to go to the Senate for vote, and they're trying to push it to have President Trump sign on the 4th, before the 4th. One of the major sticking points for everybody involved, both red and blue states, are the cost of Medicaid or reduction in benefits for Medicaid. The bill proposes to cut payments to states because Medicaid is paid by both through the US government, federal government, and states as well. They put their money together and it pays for Medicaid benefits. So the bill proposes to cut payments to the states from the federal government and have the states foot most of the cost to administer Medicaid. In effect, that will require many states to cut back on other services to cover the enrollees they have in Medicaid, as they do not have funds to cover all of their enrollees. You've heard of states going bankrupt. This is a really big problem. In addition to that, there are rural hospitals, many of which have patients that come in on Medicaid. They're already operating on tight budgets, and they've already shuttered some services, and they may be forced to close. For those of you who live in rural areas, this may leave you without access to care. You need to be aware of what's going on. If you can advocate, do it not just here for this particular administration, but I would advocate all the time because it's your health that's on the line. Next slide. The proposed changes to Medicaid are not yet known. We'll know hopefully in the next week or so, so we can get a better idea, the lay of the land and things that you need to do. And there's a big pushback on both sides as it will harm many, many, many constituents, no matter if you're in the red or blue states. Everybody who's on Medicaid may need to have Medicaid, who are in long-term care facilities can and will be affected. Being aware of possible changes can give you time to review your insurance plan and seek alternative options so you can minimize your exposure to these changes when they happen, because some of them will be happening. Next slide. 41 states participate with over 20 million enrollees in the Medicaid expansion, and it's widely adopted not just by red states, but by blue states as well. Medicaid expansion is linked to gains in coverage, access to increased healthcare affordability, and economic benefits for states and providers. Medicaid expansion is associated with improved health outcomes, including early stage cancer diagnosis, improved disease management, and lower mortality rates for many chronic conditions. Next slide. The Medicaid median income eligibility for children, pregnancy, and parents, and Medicaid spending per enrollee are higher in expansion states compared to non-expansion states, which means you have access to better benefits and access to better health coverage. Per enrollee spending in states that expanded Medicaid is higher for all eligibility groups than in non-expansion states. Some people who are in non-expansion states do not get access to the health care that they will in expansion states. Next slide. Nearly 4 in 10 women of reproduction age and over 6 in 10 50 to 64-year-olds enrolled in Medicaid are covered through Medicaid expansion. It's a lot of people. Many of these Medicaid enrollees are working but do not make enough to afford other medical insurance benefits. Now, let's talk about this just for a second because this is very important. If Medicaid enrollee criteria are changed, then fewer people will be able to afford Medicaid. They may require work requirements. They're saying maybe 80 hours per week, depending on your age and if you're not completely disabled. And if you still can't make enough money to afford Medicaid, then you'll be forced into possibly looking at Affordable Care Act if you cannot afford it through your employer. Now, the Affordable Care Act, also known as Obamacare, a lot of those, the benefits to help you reduce your premiums will expire at the end of the year. Many people will see those premiums, if they can afford Affordable Care Act now, increase 75 to maybe 200% of their premiums will increase. So many of them will not be able to afford that and will drop off insurance, but they'll be making too much to afford Medicaid. There is a big problem. They're expecting 11.8 million people to fall off of of healthcare. This is going to be a huge problem. Many people will be going to hospitals. Hospitals are overwhelmed with meeting patient needs, having the resources to meet those. There'll be a lot of people who cannot afford care. So be aware of what's going on so you can mitigate, make changes if necessary to your healthcare plan. Next slide. One-third of Medicaid expansion enrollees have a chronic physical health condition, and a quarter have chronic behavioral health conditions, and those are for those who report. Almost one half of enrollees have at least one chronic condition, and 53% are Medicaid expansion enrollees. So if 53% and Medicaid expansion is reduced, the the benefit to get on Medicaid is or criteria is a lot more increased. There will be a lot more people on un covered through Medicaid. Next slide. So some of the policy changes that are targeting Medicaid expansion will reduce government spending, but also could put coverage for almost 20 million people enrollees at risk. Medicaid is funded from two sources I mentioned earlier, the state and federal government. The federal government is considering not funding or seriously reducing funding states for Medicaids, leaving states to pick up the additional costs. This will result in other services being cut or the state's rules of who will be covered changing. Additionally, Medicaid covers long-term care insurance. Medicare does not. If reductions in Medicaid credits to the states are implemented, there will be a reduction of Medicaid long-term facilities available, and the requirements for qualifying for Medicaid will change, making it harder to qualify. We currently have a shortage of Medicaid facilities. If this goes into effect, there will be fewer Medicaid facilities available for people to get long-term care. Next slide. So I went over a lot. I know there's a lot coming down in the next few days by the end of they're hoping by the end of the week. But if you get on our website onto Financial Connect, scan the QR code, I will let you know what's going on. So it is important for you to determine what's important for your insurance coverage, what you anticipate your income to be. Make sure you review all options available to you in your state, not just a few that somebody be pushing at you. Be aware of those scare tactics so that you can make the best decision for you. Review your options and seek reliable resources for help. Do comparisons of insurance options. If you are on Medicaid currently, be aware of the work requirements that may be coming. If you have children, if you're not working for a period of time, you may be taking care of someone, and that's why you cannot work. Be aware of what's coming. 80 hours per month if you are not disabled and are of a certain age. If you're in the process of applying for Social Security disability income, do it as soon as you need it. And it's taken approximately, and this was before a lot of the cuts at the Social Security office, 22 months for your application to be reviewed. That's an average. Consider hiring an attorney who can help you minimize any of the problems associated with putting an application. Reach out to one of our experienced financial coaches here at HealthTree with your specific concerns and questions. We will do everything we can to answer them. If we don't have the answer, we'll find a person or find the resources for you. We can help you navigate the Medicare system and give you valuable tips to make sure you are considering all of your options so you can make the best decisions for you. Go to healthtree.org/community and coach and reach out to a financial coach. We'll be glad to assist, and we don't just talk to you one time. We can have a good relationship to let you know what's going on to help you mitigate any problems both now and in the future. Thank you so much for joining. Again, here's that QR code. Please sign up. You can talk to us, you can make a comment, you can ask a question, and I will respond to you, or one of our financial coaches will.
Okay, thank you so much, Diana.
Mhm.
There is a lot coming up and also a lot of information that I wasn't aware of. So thank you so much. I just wanted to remind everybody this is time for the Q&A portion of today's program. We do have some questions already in the Q&A, but if you do have a question, feel free to just click on that Q&A button and type it in, and we will get to as many questions as we can in the next 20 minutes. So first question, it came in pretty early. It said, I see you're going to cover the pitfalls of Medicare Advantage plans. Are you going to talk about options when enrolling in Medicare before 65 when on disability? I found that there were few supplement plans available and all were only Category A, minimal coverage. Also, the premiums are a lot higher than if I'd been 65. I went with an Advantage plan for the last 3 years and have had very little issues with them denying tests, treatments, or other medications.
That's and again, wonderful. Medicare, and just like Medicare Advantage plan, vary among not only insurance providers, but they vary among states. Medigap plans, your eligibility to sign up for them and to change within them also vary among states. I mentioned those 12 states that give you those birthday rules, and I mentioned the other states that allow you to change anytime in a Medigap plan. The pre-existing condition is one of those big cases. If you don't sign up when you're first eligible, whether it's through prior to age 65 based on disability, or at age 65 when you're on Social Security and you have an option to sign up for it, you need to be aware of those enrollment dates. And if you're on disability and the states that will give you the options to change or to modify your plan.
Perfect. And this one kind of rolls right into that question.
Mhm.
Just asking about changing. It says, can I change my Medicare Advantage plan and or associated prescription plan outside of open enrollment based on a new diagnosis of smoldering myeloma?
Generally, no. You can only do it for if you moved out of the area or your Medicare Advantage plan dropped or completely dropped for that area. There are certain criteria where you can change that Medicare plan, but not just because something happened to your health care. No.
Okay. Next question is, if I sign up for Part B prior to 64 and 9 months due to disability, and get an opportunity to sign up for Medigap at 64 and 9 months without prior condition impact in Indiana, at least that was a case when I signed up. Oh, sorry, there wasn't a question that I was just talking
Okay.
through signing up. There we go. Next question says, does Medicare use individual income or household income?
Does Medicare?
Yeah, does Medicare use individual income or household?
They would look at household income. However you sign on your IRA, on your taxes, they'll use household income. I know it seems strange because you're getting your plan and your spouse may be a different age and they'll get their Medicare plan later, but they'll look at the entire income. Now, if you decided to do something with um, sign up, do your income taxes separately, you may have options with that, but I usually look at household income.
Okay. Is there a Medicare Advantage plan that covers in more than one state? Mine is in California and I want to move to Idaho.
Interesting. There are thousands, literally, of Medicare Advantage plans. I have heard of some people where they were one of our coaches, and he'll be glad to tell you his experience. Patrick Kelly, if you have any issues with Medicare, he's a great person to talk to, Medicare Advantage. He lives in Nashville and had some medical issues in Nashville where he had some treatment done, but he had to have new treatment done and corrections to that treatment done. But he went to New York and his Medicare Advantage did span and work with that. But it depends on the plan, depends on what state you're in, and you need to inquire about that ahead of time before any treatment is done. So you won't be stuck with that out-of-network costs.
Okay, thank you. Next one says, I just found out that I have $257 a month extra payment for my Plan B besides my premium. Is there any way to mitigate that?
If that 257 was, you have a deductible, you have your premium. If it is based on a surcharge because your income was higher, and I mentioned this earlier, if your next year your income has been reduced, you can go and appeal that surcharge, that upcharge on your Medicare Plan B. If it's because you signed up when you late before when later than you were supposed to at your regular open enrollment, then that is going to follow you for the rest of your life. You cannot appeal that. That's why it's
Oh,
so important to know whether you're signing up for it, even if you're on disability prior to age 65. You need to make sure you check that so you won't fall. you won't get stuck with that surcharge.
Okay, thank you. I was just during the beginning, I know we talked a lot about some of the different pitfalls you may see in the brokers or the agents. Is there a reputable source to figure out who is a good broker or agent? Is there something like the Better Business Bureau, or would that be a good place to start?
The state health insurance program has Medicare have agents who are aware of the exchanges, they're aware of Medicare, and they can direct you to not only resources that can help you cover to look for agents or brokers. There's Medicare 360. Um, there are independent organizations out there. Now, if you went through your state health insurance program, there's no charge for them to do it. If you go to a thing like a Medicare 360, this is a separate independent employment, a group, and they will charge you depending on what kind of services it is. And a lot of times that might be minimal every year. They'll make sure you don't drop through the cracks. They'll make sure you're insured. You go do comparisons for new insurance things. They'll know what formularies are dropping off or on. They'll do a lot of the background work for you, and you just go to them and say, I need to review this. They'll review it for you, and they'll take care of it on your behalf. And it's worth, I think, if you, especially if you're in have a complex medical situation, you work with varying specialists over maybe more than one state, over the state, because Medicare Advantage plans you could be stuck in one particular area versus the entire state. So they would help you maneuver within that space. Again, state health insurance program will direct you to reputable agents, and they don't cost you anything.
Perfect. We'll get that information and put it in our follow-up email as well. Within that, would that also be so if somebody wasn't able to pay an independent broker to keep an eye on what's going on in their own individual case, what's the best way for them to see what Medicare options are available in their area?
That would be through the state health insurance program. And you can call cms.gov and they can direct you to people as well. And these are people who are trained and licensed, and they'll know how the correct sales methods, and they'll be able to tell you things to be aware of.
Perfect. Thank you so much. Got another question that says, so if you have a retirement or COBRA with an employer greater than 20 with that has greater than 20 employees, is it better to have the primary or Medicare primary?
At that point, your insurance will pay what Medicare would generally pick up, or your Medicare. Yeah, yeah. So that whether your Medicare is primary or your insurance is primary, they're only going to pick up what the other one would pick up, and then pay the difference. So they're not going to do this complete different thing. They're coordinating their benefits.
Next question is just asking about how do I identify and sign up for a financial coach?
So you go onto healthtree.org and you go, and it's going to, our things change, our platforms have changed recently. You go in there and you'll look for community and you'll look for coach and they'll tell you ask what kind of disease you have. You put it in there because our coaches either sign up for myeloma financial coaches or I believe AML or CLL is on there. If you have a different blood cancer, and I try to make all of these financial webinars that I do is cross blood. It's not specific to any blood type. So if you go in there, you may have to sign up for, and I'm not sure how they're doing that. If you need a coach and you're like MDS or some of those other blood diseases, talk to one of our financial navigators if you call into our site, and they'll be able to help you find a financial coach because we don't want anybody to be turned away because they can't get those financial questions answered. If you want to ask for me, you want to go in and go into my email address or go in and ask for me, and I can direct you to help you or direct you to a financial coach that can assist you.
Perfect. And I'll actually just share my screen real quick and show everybody what it looks like when you land on our website. So it would just ask you what we can help you with today. So you can go to the financial advocacy program. If you're looking specifically for coach, you could just click on this community button up here at the top. And it'll take you to our coach section and community section, and you would just click on coach right there. This would also be a way that you could click on the connect as well. Again, we will send all of those resources in our follow-up email as well.
Great. And please sign up for Financial Connect so you can keep up to date on the greatest, latest. I'm sifting through all this information. I'm gathering all this information. I'm putting everything out there that's pertinent to our cancer patients so that you can be aware of what's coming down, so you can be informed and make best decisions for yourself.
Right. It looks like that is all the questions we've got for today. So I just want to thank you again, Diana, for putting
Mhm.
together today's presentation and for everything you do for us. We really appreciate it.
You're welcome.
Thank you. And just as a reminder, as I get this next little bit back up, um, we do have our financial Q&A next month. So if you do have any questions that come up after today's program and you want to go ahead and get those questions answered, our next financial Q&A will be in August. It will be the first Tuesday of the month. Diana does her programs every first Tuesday of the month at 1 p.m. Eastern, so we can keep a little bit of continuity there. So I just wanted to share a few of our upcoming events we've got in the coming weeks. So tomorrow, Wednesday, July 2nd, we've got an event for our AML community. We will be demystifying NPM1 and AML and what it means and why it matters. And then immediately following that event at 5 p.m. Eastern, we have Fighting Chronic Cancer with patient Ruth Fain Revel. Ruth is a patient herself, and she's just going to talk through what it's like to live with a chronic cancer, but also what she does on the advocacy and writing space. And then we've got a myeloma webinar the following Wednesday, July 9th at 4 p.m., Finding Strength in Community, How Support Networks Empower Myeloma Patients. I'll put the link in the follow-up email to sign up for all of these and many more events. You can also go to healthtree.org. We wanted to highlight one of our special events right now. We've got a new program that we're highlighting, which is our Connect to Cures program. We've got a list of the cities that we'll be visiting. So if you live in those cities and want to join us, you can just scan that QR code. I'll also put it in our follow-up email as well. I want to again thank our sponsors, Pfizer, Adaptive, Curie Oncology, Johnson & Johnson, GSK, AbbVie, Amgen, and Taiho Oncology. And lastly, I want to thank you all again for joining us today and for sharing in this adventure with us all. I've got my email address on the screen. If you ever want to reach out, I love hearing from